Today I'll talk about the first month after duodenal switch surgery. Hi, welcome to my channel. My name's Tina, and if you're new here, I had traditional duodenal switch surgery on June 9th of 2020. I'm currently about 13 months out from my surgery. And today I would like to talk about something that I haven't really talked about very much. And I had plans to do a grocery haul today, but I just had a change of plans. So this is what we're doing today. I would like to talk about the first few weeks after your surgery. And I've talked about, the bad things that happen. I've had a couple of videos about just bad things that I experienced after my surgery. And I just to be completely honest and straightforward about it, the only complication I had was I had a blood clot in my intestine after my surgery, so I had to go back in the next day and have another surgery to remove that. But the other really common things that can happen, I didn't have any of those issues, and so I don't consider it. I think sometimes I might portray it as things that you can handle or things that you can help yourself. There are things that you can do to try to help yourself, but there are times and situations after you have really any bariatric surgery, any surgery, where you don't really have control over everything like you want to. So that's kind of what I want to talk about. So I just to a little bit of background about me. I had my surgery in June of 2020. I had went into surgery. I was out of surgery for a night. I stayed in the hospital for one night, and then the next morning after the next day, they didn't want to release me, and I had been told before I went into surgery that it was probably just a one day stay. And so my husband was there, and this was during the COVID thing. He's the only person that could see me there, and he was asking questions about when I could go home, and I was just massively out of it. So they gave me a lot of pain medication, so I don't remember feeling the only pain that I ever had during that period of time is if I tried to bend over at the waist. But I know that that's not normal. I know that's not common. I know it's okay and to be expected to have some pain after you have, you literally have your stomach basically almost totally removed, and except for like maybe 20% of it. And then you have your intestines rerouted so that you have the, the malabsorption piece. And also, I had, I had my gallbladder removed. I had a hernia repair. I had a lot of things, and so I had some pain, but I was on so many pain medications that I really did not feel anything other than when I bent over. So I wanted to just share a little bit about what could have happened and what isn't unusual and isn't. I mean, it's not necessarily going to happen, but I just want to make it clear that it's not necessarily something that I did to prevent that from happening. And the main issue that people have after they have any kind of surgery, really, but bariatric surgery seems to be a big piece of this, is dehydration. And I understand that because I still don't have a drive to eat or drink, and I'm 13 months out. I drink because I'm in the habit of drinking. In fact, while I'm talking about it, I think I'm supposed to take a drink of water. And that's just my life now. I drink because I think of it. I drink because I remember I need to. I eat because I think of it. I eat because I remember I need to. And sometimes if you have this surgery, something's going on and you might, in fact, I think I've heard many times where you have your surgery and then you have to sip. Then they give you these little cups in the hospital so that you can practice sipping water. I didn't ever have that. I could always just glug them. But I think that sometimes when you have all this stuff going on, I think you have to really sip and be really gentle and really intentional about whatever you're taking in. And so because of that, and because of the fact that you just literally have no drive to consume anything, it just disappears. It's really, really common to get dehydrated. And dehydration is really scary for a lot of reasons. If you get dehydrated, you don't necessarily, it's one of those things where you don't necessarily realize what the problem is. You can have you can have a really bad headache, you can be really lethargic, you can be just confused or whatever, but you might not necessarily understand that you're dehydrated. And so that's just something that, again, I don't necessarily think that I think that's something you have to be really, really intentional about. And even if you are really, really intentional about it, you still might have a lot of trouble consuming liquid. It might just really hurt. And I don't know why. I think that's something that you need to talk to your physician, your doctor's team about that if that happens to you, but it's really important and it's not uncommon. The other thing is, I talked a little bit about the bathroom situation and how at first for me, I had very bad diarrhea for the first couple of weeks, and then after I started my protein shakes can make you very, very constipated. And so that's while you're healing, while all that stuff inside of you is healing, being constipated is terrible because you can't really, it's not like you can resolve that. You can't, everything hurts, everything's just kind of tender. So that's not uncommon. And the protein shakes still, if I don't take care of other things, if I don't make sure that I'm getting enough fats, and enough water, I will still get constipated from all the protein. So protein shakes will make you constipated. And, it really is not pleasant. And you go from very runny stools to very, very hard to pass stools. And that's not really a complication. I think that's just a normal part of it. There's also things that can happen with, you could get infected. You could have an infection. I don't even remember how many incisions I had because of all the other things, this hernia and the gallbladder and this surgery. I think I had like 9 or 10 incisions, big like scabs on my stomach. So there's a lot of wounds, and it very easily can get infected, and you don't really have the energy to take care of all of that. You're, at least for me, I was completely exhausted. So every little bit of energy that I had was devoted to consuming water or consuming protein or just, talking too much. I did shower every day, which I don't know if that's necessarily a good thing because that gets everything wet, and so that might have made things even worse and made them easily get infected. I'm not sure, but just know that things can get infected and things can go wrong, and your surgery, doctors are human and your surgical team is human, and so I just want to make sure that number one, you understand, if you're watching my channel, you understand that I'm not a medical professional. I'm not a nurse. I'm not a doctor. I have no training in that regard. I'm just sharing my experience. And I definitely would encourage you to feel comfortable. Make sure you feel comfortable talking to your doctor. Make sure you feel comfortable talking to whoever you're working with in the surgical team. It's really, really important that you're able to talk about openly and honestly about what's going on. And not, some of us really like to be brave and not really complain, and that's not always a great thing. Sometimes you really have to complain. And it's not, if you complain about being in pain, that's important. I mean, there's some pain is to be expected, but that's not for me to decide, and that's not really necessary for you to decide. If you're having pain, you should probably talk to somebody in your surgical team about it. If you're having trouble consuming water, or if you're having just general issues, if you're confused, just whatever is going on, feel faint, some of that stuff might be normal, some of that might be okay, some of it might not. So I just want to strongly encourage you, if you have surgery, just to know that it's really important that you're comfortable with your surgeon, and really, really important that you're comfortable talking about things openly and honestly. So that's my soapbox for today. I again am planning on doing a grocery haul next time. So I'm going to start doing my videos downstairs in my dining room again. So that will happen, I think, next week. We'll try. Without the motivation to eat is the lack of motivation to go grocery shopping. So I just need to get that done. So anyway, I hope you're all well. I hope you're taking care of yourself. And if you're interested in my content, I hope you please subscribe to my channel. I really, really appreciate it. And to all the people that have recently subscribed, I thank you so much. I'm so excited to meet you, and I just really appreciate you taking the step to subscribe to my channel. It means a lot to me. You don't even know how much it means to me. I'm so appreciative. So anyway, thank you so much for watching, and I hope you're having a great day, and I will see you next week. Thank you. Bye.